Myself, Mrs. Haleema Shahin DH, Assistant Professor in the Department of Pharmacology, Yenepoya Pharmacy College and Research Center. Today in this topic, I am going to discuss about diabetes mellitus. At the end of the sessions, you should be able to define diabetes mellitus, etiology and clinical manifestations, to explain the pathophysiology of diabetes mellitus, to know the complications of diabetes mellitus. Come to the introduction part. What is diabetes? So diabetes mellitus is defined as a heterogeneous metabolic disorder which is characterized by chronic hyperglycemia, glycosuria, hyperlipidemia with the disturbance of carbohydrates, fat and protein metabolism. Diabetes is due to either pancreas which is not producing enough insulin, or the cells of the body is not responding properly to the insulin which is already produced. So, we will come to the classification and etiology of diabetes mellitus. Type 1 diabetes mellitus, type 2 diabetes mellitus, other specific type of diabetes mellitus and gestational diabetes mellitus. We will study what you mean by type 1 diabetes mellitus. This was earlier called as insulin dependent diabetes mellitus because it was known that the patients who have absolute requirement for the insulin replacement as a treatment, or juvenile onset diabetes due to its occurrence in younger age. It was either called as insulin dependent diabetes mellitus or juvenile onset diabetes. The incidence of occurrence of type 1 diabetes mellitus is 10% cases of diabetes mellitus. The patients are more prone to ketosis here. Again, this type 1 diabetes mellitus is classified into subtype 1A diabetes mellitus and subtype 1B diabetes mellitus. Subtype 1A diabetes mellitus is mainly immunomediated diabetes mellitus, autoimmunodestruction of beta cells, which is usually leads to insulin deficiency. Subtype 1B diabetes, either idiopathic diabetes mellitus or characterized by insulin deficiency. Type 2 diabetes mellitus. Earlier it is already called as non-insulin dependent or maturity onset diabetes, since it affects more older individuals, but now it is known that it also occurs in the people who are obese adolescent children. It is mainly characterized by insulin resistance, which is because of sensitization of insulin receptor and reduction in the number of insulin receptor, impaired or delayed insulin secretions and excessive or inappropriate glucagon secretions. The incidence of occurrence of type 2 diabetes mellitus is nearly 80%. Other specific type of diabetes, it is other than type 1, type 2 diabetes mellitus, is mainly because of maybe the genetic defect in beta cell functions due to the mutations in variation in the enzymes, is earlier called as maturity onset diabetes of young or MODY. Genetic defect in insulin actions, example is type A insulin resistance. One more, disease of exocrine pancreas, example is chronic pancreatitis, the pancreatic tumors, that is cancer of pancreas and post pancreatectomy. Endocrinopathies is mainly because of the syndrome called as acromegaly and Cushing syndrome. Drug or chemical induced, drugs such as steroid, some of the thyroid hormones, thiazides as well as beta blockers may induce diabetes mellitus. Some of the infections such as congenital rubella also may cause diabetes. Other genetic syndromes are example Down syndrome and Turner syndromes. One more diabetic type of diabetic mellitus is gestational diabetes mellitus. About the 4% of pregnant women may develop diabetes mellitus due to the metabolic changes during pregnancy. But although after the delivery, it may revert back to the normal glycemia, or these women are prone to develop diabetes mellitus in their later life. Now we will come to the pathogenesis of diabetes mellitus. Depending upon the etiology of diabetes mellitus, hyperglycemia may result from the following reason. The one reason is reduced insulin secretions, reduced insulin actions, decreased glucose use by the body, or increased glucose productions. How normal insulin metabolism is taking place in the body. Insulin is synthesized in the beta cell of pancreas. For this, glucose is mainly key regulator of insulin secretion from the beta cells. Here, half of the insulin is degraded in the liver while the remaining half enters the systemic circulations. One come to the pathogenesis of type 1 diabetes mellitus. The main phenomena in type 1 diabetes mellitus is destruction of beta cell mass. It mainly usually leading to the absolute insulin deficiency. So, pathogenesis of type 1 diabetes mellitus is explained on the basis of these three interlinked mechanisms. The first reason is genetic susceptibility. In identical twins, there is 50% of chances of second twin will get the diabetes. About half of the cases with the genetic predispositions have the susceptibility gene which is located in the HLA region of chromosome 6. The second cause of the pathogenesis of type 1 diabetes mellitus is autoimmunofactors. Here, the presence of islet cell antibodies against glutamic acid decarboxylate. GAD, glutamic acid decarboxylase, is mainly involved in nerve functions, but it has highly effective in production as well as regulation of insulin action in the body. So, whenever there is a presence of islet cell antibody against GAD as well as insulin, if it is there, then it will cause type 1 diabetes mellitus. One more reason is occurrence of lymphocytic infiltrate in and around the pancreatic islet termed as the insulitis. Selective destruction of beta cells while other islet cell type remain unaffected. Association of type 1 diabetes mellitus with other autoimmune diseases such as Graves' disease, etc. One more factor which causes type 1 diabetes mellitus are certain environmental factors which involves some viral infections, example mumps, measles, etc. Experimental induction of type 1 diabetes mellitus with certain chemicals has been possible, example alloxan, pentamidine as well as streptozotocins. Some geographical as well as seasonal variations. In winter, the insulin secretion will be low and the glucose production will be more. In the hot or summer season, the physical activity will be more. Because of that reason, there might be a high production of insulin in the body. Possible relationship of the exposure to the early bovine milk proteins. So, it is nothing but the bovine milk proteins which is present in the milk which is similar to that of the beta cells. So, because of this reason, there may be a chances of getting type 1 diabetes mellitus. What is the pathogenesis of type 2 diabetes mellitus? The basic metabolic defect in type 2 diabetes mellitus is either delayed insulin secretions or the peripheral tissues are unable to respond to the insulin, or sometimes the production of glucagon will be more or secretion of glucagon will be high. The first factors which comes under pathogenesis of type 2 diabetes mellitus is genetic factors. There is approximately 80% chances of developing diabetes in the identical twin if one twin has the disease. A person with a one parent having type 2 diabetes mellitus is at an highest risk of getting diabetes. But if both the parents have type 2 diabetes mellitus, the risk is offspring rises to again 40%. Second factors which comes to the pathogenesis of type 2 diabetes mellitus is constitutional factors. Certain environmental factors such as the obesity, hypertension and the level of physical activity plays a contributory role and modulate the disease, as lifestyle also causes the type 2 diabetes mellitus. One more reason for type 2 diabetes mellitus is insulin resistance, which is lack of responsiveness of peripheral tissue to the produced insulin. What is the mechanism of hyperglycemia in these cases is explained as below. Resistance to the action of insulin impairs the glucose utilization and hence leads to hyperglycemia. There is increased hepatic synthesis of glucose, or the hyperglycemia in obesity is related to the high level of free fatty acids. The one more reason for the type 2 diabetes mellitus is impaired insulin secretions. In the type 2 diabetes mellitus, insulin resistance and insulin secretions are interlinked. Early in the course of disease, in response to the insulin resistance, there is compensatory increased secretion of insulin, which is in attempt to maintain the normal blood glucose level. But eventually, there is a failure of beta cell function to secrete the adequate insulin. Although there is some of the secretion of insulin, that is in case of type 2 diabetes mellitus, which have mild to moderate deficiency of insulin, but not total its absence. The increased hepatic glucose synthesis. One of the role played by the insulin is to promote the hepatic storage of glucose as glycogen and suppress the gluconeogenesis. But in type 2 diabetes mellitus, as a part of insulin resistance by peripheral tissues, liver also shows insulin resistance. This results in increased hepatic synthesis of glucose, which contribute to the hyperglycemia in these cases. This is a graphical representation of pathogenesis of type 1 as well as type 2 diabetes mellitus. So, here it comes to genetic susceptibility, environmental factors which is responsible for the pathogenesis of type 1 diabetes. What are the autoimmune factors which are responsible for type 1 diabetes mellitus? Comes to the pathogenesis of type 2 diabetes mellitus, genetic factors, constitutional factors, decreased insulin secretions, insulin resistance, which increased hepatic glucose synthesis, which leads to hyperglycemia, then it turns to type 2 diabetes mellitus. Next comes to the complications of diabetes mellitus. So, the diabetes mellitus is not only a disorder where the morbidity and the mortality is high. The complications which is led by diabetes mellitus also leads to the morbidity and the mortality of many of the cases. In the complication of diabetes mellitus, it is again classified into acute metabolic complications and late systemic complications. In acute metabolic complications, examples are diabetic ketoacidosis, hyperosmolar hyperglycemic non-ketotic coma and hypoglycemia. Late systemic complications are atherosclerosis, diabetic microangiopathy, diabetic nephropathy, diabetic neuropathy, diabetic related cardiac disorder as well as some kind of infections. What do you mean by acute metabolic complications? Ketoacidosis and hypoglycemia are the complication of type 1 diabetes mellitus. Hyperosmolar hyperglycemic non-ketotic coma is a complication of type 2 diabetes mellitus. We'll study what we mean by diabetic ketoacidosis. It is a serious diabetic complications where the body produces excess blood acids, so it is called as ketones. The symptoms of this diabetic ketoacidosis: a person may feel anorexia, nausea, vomiting, deep and fast breathing, mental confusion, and finally it leads to coma. Hyperosmolar hyperglycemic non-ketotic coma. It is caused by severe dehydration resulting from sustained hyperglycemic diuresis. The loss of glucose in urine is so intense that the patient is unable to drink sufficient water to maintain the urinary fluid loss. So, one more complications of the disorder is hypoglycemia. It may result from excess administration of insulin, maybe missing the meals or due to the stress. Hypoglycemia may produce permanent brain damage. The late metabolic complications. These complications may develop after the 15 to 20 years of diabetes mellitus. Late complications are largely responsible for premature mortality in diabetes mellitus. Out of that, atherosclerosis. Diabetes mellitus of both type 1 and type 2 accelerate the development of atherosclerosis. What is the main cause for this atherosclerosis is hyperlipidemia. The lipids as well as the carbohydrates are interlinked. These metabolism also interlinked, which leads to hyperlipidemia, reduced HDL level, obesity and associated hypertension in people. Diabetic microangiopathy. Microangiopathy of diabetes is characterized by the basement membrane thickening of the small blood vessels and the capillaries of the different organs and tissues such as skin, skeletal muscles, eye and the kidney. Diabetic nephropathy. The renal involvement is common complications and leading cause of death in diabetes. Initially, there is a proteinuria or increased outflow of protein which may lead to the end stage renal disease. Next comes to the diabetic neuropathy. Diabetic neuropathy may affect all the part of the nervous systems. Next come to the symptoms of diabetes mellitus. A people who are diabetic, they are always tired, frequent urinations, there is sudden weight loss, wounds that will not heal, there will be a sexual problem. A person who is diabetes will be always hungry, there is a blurry visions, numbness in the legs, always thirsty, vaginal infections. So these are my reference. Harsh Mohan Textbook of Pathology, JP Brothers Medical Publishers. Thank you.